I'm really honored to be able to speak about the academic contributions of Robert Bond Welch. Everybody who knew Dr. Welch knew that he was tall. He was 6 foot 6 inches tall and is a true Marylander, having graduated from Annapolis High School before going to Princeton, Johns Hopkins, and an internal medicine internship at Duke University. He was going to be an internist but changed his mind and became an ophthalmologist, getting his training at the Wilmer Eye Institute, uh, where he eventually became the chief resident. Now, I could talk about all of his accomplishments. Dr. Jensen is going to talk about many of those. He was the director of the American Board of Ophthalmology, the president of the American Ophthalmological Society, uh, was given the Superior Civilian Service Award for his long-standing work as a retinal consultant at the Bethesda Naval Hospital and Walter Reed Hospital. He was GBMC's inaugural Physician Titans of Care to recognize his career and service. He had a keen interest in Wilmer. He wrote 2 editions of the History of Wilmer Eye Institute and was the president and secretary of the Wilmer Residents Association. Dr. Welch's career spanned 42 years. He had a major impact on ophthalmology, retina, and Wilmer. He really embodies the history of ophthalmology, retina, and Wilmer. He brought state-of-the-art retina care to the Wilmer Institute. He trained with Dorman Pischel in San Francisco. Dr. Pischel is the grandfather of retinal detachment work in this country. Dr. Pischel went back to Vienna to learn retinal concepts, and in 1933 he presented a series of a 50% success rate with retinal detachment repair. Dr. Pischel introduced very careful examination using a direct ophthalmoscope. Dr. Welch also had the opportunity to do a fellowship with Charles Scapins at the Massachusetts Eye and Ear Infirmary. Dr. Scapins himself has a very interesting past. He worked with the resistance during the Second World War under an assumed name, migrated to France, to Spain, and then to England. Dr. Scapins is known as the father of retinal detachment in this country. He introduced indirect ophthalmoscopy and scleral depression, which is perhaps one of the biggest advances in examination technique for retinal diseases. Dr. Welch brought these concepts back to the Wilmer Eye Institute. Dr. Welch took great pride in his cartology, or depicting retinal diseases, in his fundus drawings. This has become a lost art due to the introduction of the electronic medical record. Dr. Welch was a keen observer, which was a requirement for the accurate and beautiful depictions of different retinal diseases. Dr. Welch embraced change to advance ophthalmology. In 2008, Dr. Jensen conducted an interview with Dr. Welch for the AAO, and it's currently in the Museum of Vision and Ophthalmic Heritage. Dr. Welch said the following: "Well, it's always amazing how there is resistance to new ideas. Even with things that come along that prove to be very valuable, there was resistance. I always remember reading Gonen's work on finding the retinal hole, that you had to seal the hole. The first instrument that he used to treat that was ignipuncture. It was a wood-burning instrument that he went to the toy store and bought, things that you did wood burning with. He'd heat it up, localize the tear, and jam it through the sclera. Well, there was an uproar all over the world. Here was absolutely the worst thing that could happen to a person, but he was right on." Many innovations occurred during Dr. Welch's career, and he embraced all of them. Photocoagulation by Meyer Schwickerrath in Germany. Lasers were developed by Dr. Francis Lesperance. The argon laser by our own Dr. Arnell Patz. Cryosurgery was reintroduced. Cryosurgery was used for retinal detachment repair in the 1930s and was also introduced for cataract surgery during intracapsular cataract extraction. Linkoff and others brought cryosurgery back into use. And of course, vitrectomy was invented by Robert Mockmer, which revolutionized how we manage retinal diseases today. Dr. Welch was the co-director of the Retina service here for 25 years with Dr. Harold Pierce. He provided greater understanding to numerous retinal diseases, from unusual conditions like von Hippel-Lindau to a bit more common diseases such as sickle retinopathy and pars planitis. He's certainly known for educating future leaders. His 1970 American Ophthalmological Society thesis was on advocating for the recognition and treatment of early von Hippel-Lindau lesions using cryotherapy. Here you can see some of the renditions of the different changes that are seen in von Hippel-Lindau. He wrote a seminal paper on sickle retinopathy with the Wilmer resident. The resident identified the morphologic similarity of Gorgonia flabellum, which is a sea fan, with neovascularization in sickle disease. This resident made that observation while scuba diving in the Bahamas while on vacation. Dr. Welch then showed this resident his Gorgonia specimen from his own collection. This term has remained part of sickle retinopathy ever since. This paper was published in 1966 in the archives with Dr. Welch and our own Mort Goldberg, who was a second-year resident at the time. This paper launched significant expertise in sickle retinopathy. Dr. Goldberg has gone on to publish 89 papers on sickle retinopathy, which is only a small contribution of his over 400 peer-reviewed publications. We all know he's the former director of the Wilmer Eye Institute. In a sense, he's passed on this expertise and the legacy to Dr. Adrian Scott, who is an associate professor in the Retina division. Dr. Scott has focused on sickle retinopathy using OCT angiography imaging and correlating the changes in the retina with silent cerebral infarcts in young children with sickle disease. I believe that the legacy, the contributions of Dr. Welch will provide a long-lasting legacy for him. In addition, a professorship was established in his name. Dr. Julia Haller was the inaugural Welch professor, and in part because of her talents, and in part because she was a close family friend with the Welches. She was a longtime Retina division faculty member before going on to becoming the director at the Wilmer Eye Institute. To meet Dr. Welch's standards, one had to acknowledge the importance of innovation. One had to be willing to embrace change. One had to always communicate with empathy, humility, and grace. And it was important for him to make today's students tomorrow's leaders. Because of all of these attributes, the legacy of Dr. Robert Bond Welch will live on, and he's made a lasting imprint on ophthalmology, retina, and the Wilmer Eye Institute. I feel honored to carry his professorship, and I appreciate having the opportunity to provide some background on all of his accomplishments. And I thank you for your attention.